We developed something we call Dawn of a New Day, and that's our memory care program. We have 16 hours of mandatory training that is called the Wellbeing Academy. It's 4 hours, 4 days, all in a row, and we make it mandatory for not just our caregivers in memory care, but everyone who touches any kind of dementia care. So it could be the bus driver, dietary, whoever. We also do some fall prevention in that area. We're working with a couple of different companies, one called Safely You, and it involves decreasing the falls, especially in memory care, based on what we see at night. And that's been, we're just starting to pilot it, so it's been going pretty well so far. We're looking forward to really good outcomes once we get going with it more. The other things that we do for Dawn of a New Day is we have specific life enrichment directors that are there, and they have learned more about how to enrich their life through activities, not just your usual bingo or whatever, but different things, thinking outside of the box and having engagement stations where there might be clothes you can put on that are the period of the residents who live with us. So a lot of different things like that. Yes, we're always kind of looking at what's new and different, because part of our mission statement is innovation and improving lives through innovation. So currently we're using a product called K4 Connect, and so we've rebranded that for us to be Eskaton Connect, and it involves tablets for all the residents. And with those tablets, they are able to talk to their families, to connect with their families. They also can use it to not just call, but FaceTime. They can look up different programs that are on the K4 Connect. It's worked out really well to increase social interaction with others outside of our community and within our community. We also use an iPhone type of a mobile phone that we have incorporated the Stanley product. I feel like I'm using brand names so much, but this iPhone is used to connect with the staff. So the phone, when they walk in the door, they can just type in what's going on, and it will. We can run reports off of that, so we can see what's going on. So we've been with PharMerica ever since I've been with Eskaton, and that's 18 years. And PharMerica is always there for us. We meet with them quarterly. We can call them anytime. They will look at our medications, making sure that we're not using something too much, that we're right with the new regs on keeping antipsychotics down, especially if residents have dementia. So they partner with us to keep our costs down and to make sure that the residents are getting the appropriate medications, nothing interacting. Yeah, yes, that's the reason I'm here, right. Is to learn more and what can I bring back. And we are expected whenever we come to something like this particular session is to bring what we've learned back. And then the rest is on-the-job training. So on-the-job training, sending people out to learn more, see again that innovative, what are we doing? How can we make our residents' lives better? So we have that Memory Care Academy, or Wellbeing Academy that we call it, making sure that our staff go a step above just what is mandatory education, but continuing on. So we really encourage a CNA to go up the career ladder, or dietary. We have many examples in our company of people. Just the other day, a housekeeper, then she became a move-in coordinator, and then she became a nurse, and now she's one of our coordinators of one of our memory care units. So we really encourage people to keep going, keep moving forward, and stay within our company. Eskaton does a full continuum of care, so we like to see people move through the company. I think our biggest challenge right now is workforce. With the economy doing well, that means we don't have as many jobs out there available. So people are out working, doing whatever, and then it's harder for us to find the staff that we need. And our population's aging so much, so we need more and more staff to be able to provide what we want to provide. That's probably one of the biggest challenges right now is our workforce. The other would be in our skilled nursing facilities, because we do have a full continuum, is the regulations. The regulations have continually changed, and we've gotten the new requirements of participation. So from 2016, 2017, 2018, and going forward another year, we keep having more challenges put on us that are good challenges, and it helps us improve, but it is a continual challenge, especially for my department, quality and compliance, to be compliant with all of those new regulations. It's a kind of a full mindset change to make sure we're doing what now is required of us. Yes, what we found with opportunities for our company specifically is some of the standalone communities are struggling with those new requirements, and because we aren't a standalone, we have multi-site, although we are just in Northern California, those opportunities arise for us to assist those other standalone communities, and that has really been an opportunity for Eskaton. We've been able to bring them into what we're doing, help them with our policies and procedures, and then go out and help them rise to that level as well.